Hi, I'm Dr. Ahtsham, and this video is going to be about the refusal patient. So, a patient can refuse the medication, procedure, or admission. So, anything could be there. So, do your best and try to convince the patient by following the steps. If the patient is still refusing, okay, you need to go down step by step to the end, which I'm going to tell you. So, this is the refusal patient. So, like every station, that's gonna start with building the rapport. Okay, you're gonna recruit with the patient. You need to tell your name and you need to identify the patient that you are talking to a right patient. After that, you need to ask the patient that why, okay, he is refusing the treatment or the procedure or the medication. Okay, so the patient's gonna tell you something. Okay, always acknowledge that. What do I mean by that is that you can say something that thank you for telling this reason or expressing the concern, and this is the way we can help you. So acknowledge your patient when he tells you the reason behind that. Okay. Now the next thing is try to address that reason. Okay. Try to address the reasons. If not, okay, you need to go step by step. Okay. Try to address the reason. If the patient is still refusing, you need to go to the next step. That is assessing the knowledge. Now you need to assess the knowledge of the patient and what is his understanding about his condition. Okay. And whenever you're going to do that one, that is followed by explaining the things. Okay. Whatever he knows, you need to move forward now. Okay. You need to explain to him, okay, the things which he don't know about his or her condition. So you need to explain that one. Still the patient is refusing, you need to ask the patient about the risk versus benefit. Does the patient know about what is the risk of not taking the medication or not admitting himself in case that he needs the admission or she needs the admission? So ask about the risk versus benefit. If he doesn't know, you need to tell the patient that what could be the risks of not getting admitted in the hospital if that's the situation. Now, if still patient is refusing, you can give the patient an option of talking to the senior. Okay, still the patient is refusing. Okay, ask about the mood. Okay, this is really important. You need to ask about the mood. Why I'm saying so, that if a patient, okay, by following all these points, okay, you have explained the risk factor as well, still patient doesn't want to get admitted, you need to ask the patient that how's the mood. Isn't the patient depressive? That's why he's taking a decision which is not in his best interest. So you need to ask about the mood. Still, if you see that the mood is fine, but still the patient is refusing, then you can offer. After that, you need to actually summarize. Okay, all the things you need to summarize. After asking the mood, you need to summarize. Okay, and check that the patient has all the understanding of what you have discussed with the patient up to now. Okay, if still the patient is on his point, okay, of refusing the medication, then you're gonna discharge the patient, that is discharge against medical advice. Okay, you need to tell the patient that I'm gonna write that thing, okay, what we have discussed up to now, and you need to sign that one. And lastly, you need to safety net the patient. Still, if he's not is refusing actually the treatment, you need to safety net the patient, and you need to tell the patient that anytime you change your mind, you can come to us. Okay, you can talk to us in case of the medication, or in case of admission you can come to us and we can admit you. That's not a problem. Okay, another thing, okay, is that during any of these points you need to follow all the structure, okay, in an order, okay, the way I have told it to you. But any time in between, okay, say for example you are at the point 4 or the 5 and the patient agrees, okay, that okay, I'm going to admit myself. So anytime the patient agrees, okay, start taking the relevant history, okay, and you need to verbalize the exam and then manage the patient accordingly. You need to tell the management plan. Okay, anytime in between the patient agrees and you have the time now, okay, so you need to turn it to the other thing, like taking the relevant history and Now you need to tell the patient the management plan. Okay, so this is all about refusal patient situation.